in 5 to 10 years from now? What are you working towards that will put us in better footing to deal with the next global pandemic?
Well, the next emerging outbreak with pandemic potential is going to hit us. And the risks are exacerbated by all kinds of factors, but, climate change, migration, conflict. I don't know. I mean, there's, food insecurity, water shortages. All of these factors are driving the risk of a pandemic. Is the world prepared right now to tackle another COVID-like pandemic? I would say not yet. Much more work is needed, but I think we're headed in the right direction. And those investments to build basic capacities to be able to prevent pandemics at source, to quickly contain outbreaks and prevent them from escalating, those investments are being made. More investments are needed. We really at the Pandemic Fund working with a strong sense of urgency and purpose to get the world ready, but we know what the gaps are.
Welcome to Analyzing Healthcare podcast, brought to you by Scale Community. Scale Community is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events, to interactive peer networking opportunities, and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level.
Okay, welcome to the latest version of the Scale Community Analyzing Healthcare podcast. I'm joined today by Priya Basu, the founding executive head of the Pandemic Fund. It's a real honor to have you here, Priya. Thank you for joining.
Thank you. Great to be here.
So I want to start by just giving our audience a little bit of your background, and there's so much of it that I couldn't help but just highlight a few key pieces that I just think are so interesting. So during the pandemic, you led the Multilateral Leaders Task Force on COVID-19. So there's a lot of different institutions involved in the global COVID-19 response: World Bank, IMF, WHO, WTO, and you were very much a central spearhead in all of this. Is that accurate?
So the Multilateral Leaders Task Force comprised of the leaders of those four organizations: the World Bank Group, the IMF, the WTO, and the WHO. And the task force had a secretariat within the World Bank, which I was leading and coordinating.
Yeah, so I think that's a relevant point, because that leads us to what you're doing today, which is preparing for the next pandemic, essentially with the Pandemic Fund, making sure that as many countries as possible. I read somewhere that you've committed through this Pandemic Fund to over 75 countries and 40 to 50 plus projects across these countries, all in the name of preparedness, which your focus is surveillance, so just spotting a pandemic, laboratories, so the testing, and then the health workforce, which is the clinical staff component, the actual on-the-ground practical realities of dealing with a pandemic. As we've all now, I feel like 8 billion people have become semi-experts in pandemics going through the COVID experience that we all went through. But it's still nice to know that there's someone like you who's really dedicating all their time to getting us ready for the next one. And I think we all agree it is usually just a matter of time before there is a next one. So is that a fair description of where you've been focused?
So yes, I mean, COVID-19 shone a spotlight on how underprepared the world was for pandemics. And it really highlighted chronic underinvestments in critical preparedness capacities, especially in low-income and middle-income countries. And of course, COVID wasn't the first pandemic. I mean, in our living memory, we've seen avian influenza, SARS, MERS, Ebola, Zika, and each of them has highlighted deep weaknesses in pandemic preparedness, in the ability of the world to quickly detect and contain emerging outbreaks and prevent them from becoming pandemics. So really that was the background or the context for the creation of the Pandemic Fund when once we were living through COVID, there was a realization that really the world cannot afford to be as ill prepared as it was. And so to break the cycle of what's often been called as panic and neglect, the international community came together and decided, under the leadership of the G20, but with participation beyond the G20, set up the Pandemic Fund and asked the World Bank to do that. And so that was in 2022, and the World Bank was asked to establish the pandemic fund. And I was leading that effort, convening and bringing together all interested partners, from governments to international organizations, to civil society, to philanthropies, to the private sector, to establish the pandemic fund, which really is a first of its kind multilateral financing mechanism that's dedicated exclusively to strengthening the capacity of low and middle income countries in the areas of preparedness to be able to quickly detect and contain emerging outbreaks and protect the world from future pandemics.
So you've raised a lot of funding since the launch 2022. It's now, I understand, a $3 billion commitment across 28 countries. Forgive me if the numbers have changed. With, I'm told, a 1 to 7 times leverage ratio. So for every dollar invested, there's another 7 of debt financing to support it. It's good to be part of the World Bank. So it sounds like you've got over $20 billion of available funding, and you've committed a portion of that. My question, let's start with the first question. What do you think as an operator? Because just you're speaking to a self-described operator here, and what scares me beyond all the human aspects of it, the tragedy of it, just the operational difficulty of dealing with a pandemic. Fundamentally, once it becomes widespread and, God forbid, global, the strains on infrastructure are just unbelievable. And I say, as an example of that would be surge capacity needed for dealing with crisis. All of a sudden, you need orders of magnitude more nurses, clinicians, physicians, technicians, just to deal with the wave of sick patients. So you're dealing with every aspect, the detection and then the response. What do you think is harder to prepare for, the upfront detection or the actual response?
So maybe first, just a quick clarification. So we've raised $3 billion in donor commitments from 25 governments and 3 philanthropies. And we have allocated a proportion of that. And what's allowed us to make the big impact that we've already made with projects across 75 countries and a portfolio of close to $7 billion is that for every dollar that we allocate, we actually catalyze additional financing from our partners for the projects on the ground. So we've allocated $885 million, awarded $885 million worth of grants. Through our catalytic impact, we've managed to mobilize a total of $7 billion, mostly in co-financing, as we call it, from multilateral development banks that are bringing their own resources to support the projects, to alongside what the Pandemic Fund grant is providing, but also importantly from the countries that are receiving money themselves. So that's the co-investment, because we can come to that later, but countries themselves that are benefiting from Pandemic Fund grants are actually putting their own skin in the game. So that's how, with $885 million, we've managed to provide 75 low and middle income countries with a total of about $7 billion for investments in pandemic preparedness and prevention and response. And now, coming to your point, indeed, what we saw from COVID was that really what was needed to be able to quickly detect and contain outbreaks is that surge capacity that you spoke about. So what we're doing through our investments is 3 key areas, but in each of those areas, in surveillance, we're making those investments now that will allow a country to, of course, do the surveillance, the day-to-day surveillance of outbreaks that are emerging, but also to ramp up that surveillance capacity if there's an outbreak that starts to spread. Similarly, when it comes to detection and labs, we're building that lab capacity right now, upgrading laboratories, but also building surge capacity to ramp up testing in times of crisis. And the same applies to the workforce, the health workforce, where the training and the jobs that we are creating through our investments are helping to create a well-trained health workforce to deal with daily needs that countries have, but also keeping in mind that we need a cadre of well-trained workers that can be surged in times of crisis: community health workers, doctors, nurses, lab technicians, field epidemiologists, but also importantly, veterinarians, animal health workers, livestock workers. So, one other point I want to make is that in all of these efforts that countries are making with our resources, the investments that they're making in building that surge capacity. We're taking a very multi-sectoral approach where we recognize that animal health, human health, and the environment are closely interconnected, and that most infectious disease outbreaks that have pandemic potential are zoonotic in origin. And so we take what's called a One Health approach and make sure that when we are strengthening laboratories, it's not just laboratories, not just human laboratories, but veterinary laboratories, and connecting those two. We're talking of surveillance. We're focusing on zoonotic surveillance. We're talking of the workforce. It's a One Health workforce. But again, I want to underscore the important point you made, which is it's not just enough to have that capacity to deal with day-to-day needs, but to really focus on ramping up capacity and ensuring that there's surge capacity. Yeah, that's a key element of the pandemic fund's focus.
Yeah, I mean, there's so much to learn from your experience, from our collective experience of what just happened. And I do think there is a way forward, right? When you look at institutions, in this case, healthcare. So, for example, a hospital. We're all aware of hospitals testing for rare events, right? Every year there's training for a loss of power, some kind of acute, highly destructive event that interferes with day-to-day operations. So a weather event, some kind of security breach, digital security breach, backup plan B scenarios are commonplace in terms of training on an annual basis. I would imagine that preparing for a pandemic, and what does that actually mean? What does it mean in terms of staffing, hierarchy, and responsibilities? Who does what? Resources. Something that we witnessed during COVID was all of a sudden, overnight, there was a dire shortage of masks, of all kinds of necessary medical equipment. And what we saw is surge pricing and shortages everywhere, which led to sort of market chaos. Are we getting shipments in from China to try to support us with the basics that our clinicians don't have here in pick a country? So is that getting warm in terms of some of the initial basic level fundamentals of pandemic preparedness, making sure that there is an annual, quarterly, semi-annual, recurring training program that institutions across the board have to commit to and be ready with?
Yeah, so, the approach that we're taking is very much country-driven, country-led. We're telling these countries, look, you all have national action plans for health security. Some of those are, better developed than others, but most countries have these kinds of national plans. And, part of the problem is that the plans have not been financed. So they know what they need, but they don't have the money to do it. So that's a big gap that, the
That's
pandemic fund can help fill. But also part of that plan is, of course, you need that capacity that I spoke about in surveillance labs and workforce, but you also need good coordination and collaboration across different arms of government, and in fact taking whole of society approaches, engaging communities and all of this, sort of getting ready to deal with the crisis. So our work is very much focused on coordination and collaboration, both within countries, but also importantly across countries, because we all know that pandemics don't respect borders, right? So you need kind of cross-country collaboration, you need cross-country data sharing, you need sort of collaborative surveillance capacity. In some cases, countries have come together and said that we want to actually build kind of regional workforce capacity that can be deployed in emergencies. So our projects are investing in when I talk about surveillance, it's a lot about data. It's about collecting data from the local level to the subnational level to the national level, and then sharing it across countries. We're strengthening national public health institutions at the country level, but also focusing on strengthening regional institutions that can take a lead. And I think one great sort of outcome of the pandemic, of the COVID pandemic, was really just how Africa CDC stepped up and played a really important role for the African continent. So, can we kind of learn lessons from that and build similar types of regional institutions for other regions of the world? So these are all important priorities for the pandemic fund.
Yeah, I mean, there's a lot there in what you're saying. Very interesting. One little anecdote that I heard in the past was that really resonated with me. I was interviewing a US healthcare leader who said, "You'll know that we're ready for the next pandemic because we'll be busy preparing for the next pandemic, talking about it, knowledge sharing ahead of it before the even pandemic ever shows up." But in contrast, if you're not hearing anything, if there's silence out there, then by definition, we're not going to be ready. And so I still maintain that there's not enough discourse, there's not enough focus from on the ground operators and regulators about the next pandemic, because we're, I think, still busy licking our wounds from the last pandemic. So it's almost like a case of denial.
When I travel to Africa, when I travel to East Asia, to South Asia, I do notice that the COVID pandemic is still very much on people's minds, on the minds of their policymakers as well as the general public. The developing world, the global South, really suffered a lot from the pandemic. When you go to India, people haven't forgotten about the Delta variant and the havoc that it created. This we see as an opportunity. In some parts of the world, perhaps people have moved on to other pressing global priorities and issues and needs, but the role of the pandemic fund really is to keep
the focus.
To keep the focus and to remind the world that we cannot afford to be unprepared. And also just the simple math of it, the cost of investing in these kinds of critical areas shouldn't really be seen as costs. They shouldn't be seen as expenses, but also that the investments needed are a tiny, tiny fraction of the cost of being unprepared. And COVID showed us the trillions of dollars of world GDP that were lost because we were ill prepared for we allowed a tiny virus to create havoc. And not to mention, of course, the lives lost and the ramifications. So, the role of the pandemic fund is, of course, to keep that focus on the investments that are needed. And at the same time, also remind the world that those investments needed are a small fraction of the cost of not being prepared.
Really important points there. So I really appreciate you highlighting that. The good and the bad, whether it's during COVID or since COVID, the work that you've been doing in the Pandemic Fund. I'm interested in your anecdotal examples of either great programs, great countries, great governments, great projects that you can turn to in a room and quickly point to and say, "Hey guys, for your project, for your country, this is an example that we want to try to emulate of how to build the right preparedness." And similarly, you don't have to name examples that haven't worked quite well, but just frame what are some of the most challenging projects that you've had to interact with, and what are some of the biggest obstacles that you face in order that prevent us from moving everyone up to this optimal standard that I imagine some groups have been able to reach. What are your thoughts?
Sure. So, these are still early days. We aren't even 3 years old yet. We will soon be 3 years old. But, I'm proud to share that we made a lot of progress and there are some very promising projects, ones that jump to mind. And these are some of the earlier projects that were rolled out, so they've had a bit more time to show results. So, in India, for example, we have a One Health project that stands out for many reasons. One, that it has catalyzed an enormous amount of resources. A $24 million grant catalyzed $341 million of additional financing 14 times. So we were able to reach a leverage ratio of 1:14 through that project. And what makes it stand out is that it is very squarely focused on One Health. It is really galvanizing collaboration across ministries of health, finance, agriculture, animal husbandry, taking this sort of multi-sectoral approach to building a resilient health system through training a One Health workforce, veterinarians, livestock farmers, animal health workers. India has the largest livestock population of the world, so it's a very important,
I'm not surprised, having spent time in India, that the livestock is everywhere.
Right. And the risk of zoonotic diseases is very high. But this is the first time that there's been real action in terms of, focusing on this One Health. And it's part of the government's One Health national mission. But it's really helping to train the workforce. It's helping to build surveillance capacities at district levels and laboratories, strengthening veterinary labs and connecting them with human labs, and ramping up testing capacity, point of care testing capacity. One point I do want to make here is that, the pandemic fund takes a disease agnostic approach because we don't know what the next pathogen that has the risk of becoming a pandemic is, right? So when we build that capacity for testing at the primary healthcare level, it is, providing equipment. It doesn't necessarily have to be, very fancy equipment, but, PCR testing, X-ray machines, those that can test for all kinds of different pathogens. So that India project, it's a One Health project, I think is progressing very well. Another great one we have is in Rwanda. And this one actually, again, it did achieve a high leverage ratio of 1:6. And particularly, I want to emphasize that the government has put in a lot of its own resources, brought in sizable what we call co-investments, and this is again focusing on wastewater surveillance plants and ways to do a quick surveillance of emerging pathogens. Again, it's focused on strengthening laboratories. It is training the workforce, and it was put to test last year when there was an mpox outbreak in Africa, and Rwanda was one of the several countries in Africa that was affected by mpox. And so the project really helped with the quick detection and containment of mpox. But beyond that, soon after mpox or during mpox, Rwanda was also hit by another outbreak, the Marburg virus disease, which has a very high fatality rate. I believe about an 80% fatality rate. But Rwanda was able to quickly detect and contain Marburg as well, thanks to the investments that had been made. And I'm talking about this, but the health minister of Rwanda, Dr. Zanzimana, who actually is the co-chair of the Pandemic Funds Board, speaks about this very eloquently and compellingly. So we're very proud of that project. Then we have, as I was mentioning earlier, we have cross-country and regional projects. One that was rolled out. I believe it was the first of the Pandemic Fund projects to be rolled out. It was in the Caribbean. The Caribbean Public Health Agency is the executing agency for that project, and it brings together 20 plus member states of the Caribbean, and it's managed to make a lot of progress in developing sort of a regional cross-country surveillance network using technology and AI and so on. And it was put to test last year when the Caribbean hosted the Cricket World Cup, and so apparently, it's a project that's really building the region's the region's resilience to emerging outbreaks. So those are just some of the projects, but there are lots of them. There's 47 of them, and some are, some
It's your
have
it's
had
your
more time.
portfolio of investments.
Right. I mean, another one maybe I should mention is Ethiopia. If you land at Addis Airport, you will see a pandemic fund sign right there. Ethiopia is taking this agenda very seriously, and our project has really galvanized multi-sectoral collaboration across all of government and brought in communities as well. Again, it's focusing on this One Health multi-sectoral approach, public-private partnerships, using technology and AI tools to help with data collection, data sharing, data reporting. So yes, please do visit our website. We have a lot of good examples. But of course, turning to the other part of your question, it's always not, these kinds of investments are sometimes, they take time to begin to generate, impact. Some of the countries that we're working in are countries that are fragile, conflict affected. 30% of our portfolio actually is in fragile and conflict affected states. So, there, it takes a bit more time and effort to.
You've got your work cut out for you, for sure.
Generate results. Yeah.
And it's hard to take credit for something that you help avoid.
Correct.
It's
Yeah.
always fundamentally difficult to convince the mind of the value of something that didn't happen.
Exactly.
But
that's why we we try to find tools to show results as they emerge. The mpox Marburg example I gave from Rwanda
lives
is a really good
saved
one. Lives saved
and inconvenience and disruption avoided, and putting an economic value to that. Yep.
Exactly.
Makes sense. So how optimistic should we be about the role of technology, healthcare IT, information sharing, and I'll dare say even AI from an analytical standpoint when it comes to the next pandemic? Let's assume we do actually experience, God forbid, another global pandemic. But we're lucky enough to have another 5-10 year gap between now and when that happens. What do you think we'll have in 5 to 10 years from now? What are you working towards? What are you seeing governments work towards that will put us in better footing to deal with the next global pandemic?
So first of all, many have said it's not a question of if, it's a question of when the next pandemic's going to hit us, right? And or the next emerging outbreak with pandemic potential is going to hit us. And the risks are exacerbated by all kinds of factors, but, climate change, migration, conflict, I don't know. I mean, there's, food insecurity, water shortages, all of these factors are driving the risk of a pandemic. So, is the world prepared right now to tackle another COVID-like pandemic? I would say not yet. Much more work is needed, but I think we're headed in the right direction. And those investments to build basic capacities to be able to prevent pandemics at source, to quickly contain outbreaks and prevent them from escalating, those investments are being made. More investments are needed. We really at the Pandemic Fund working with a strong sense of urgency and purpose to get the world ready, but we know what the gaps are. Digital tools and AI, you asked about that. I think they do offer a lot of promise in terms of
data gathering, data analysis,
data
information
gathering,
sharing.
data analysis for early warning systems. Digital surveillance tools are being used in, across countries for detecting outbreaks. Then also kind of laboratory information management systems using technology and digital tools for that. Improving reporting and, coordinating response as well across countries, which is a very important piece. I'm optimistic. I think AI and technology offer a lot of promise, and we're already seeing some of this playing out in our projects. I can think of Paraguay, Philippines, Rwanda again. So I think, yes, I think there's a lot of opportunity. And in fact, I should say that we also see here opportunities for building on sort of partnerships on the ground with the private sector. We have recently launched an external advisory council, which includes several key players that are involved in sort of the digital and AI space. And we hope for them to also bring their ideas and lessons to us upstream so that we can weave those into framing what we ask for in the future.
I'd like to follow up with you on that. That sounds fascinating. I still think we're left with this strange place where public at large is confronted with the true extent, the complexities of public health during pandemics. Whereas in normal day-to-day, public health is sort of this thing that we do, whether it's France or the US or India or China or Ghana. Public health is something that your government does to help the disenfranchised, the less fortunate amongst us get access. But in a pandemic, every one of us is a public health per capita citizen that requires public health response. And most of us as citizens of our respective nation states don't go through that training of what that means. So the whole language is complicated, restrictions, new rules, all with the intent of preserving public health. But these are episodic exposures to public health. We're used to individual health, whether it's government funded or privately funded. I need a surgery. I don't have to think about 350 million other people in the US when I start thinking about my surgery. I think about my schedule, right? My resources. All of a sudden in public health, everyone's needs become part of the calculation. And we all become very aware of that. But I don't know that as a populace, all of us are fully trained for that mind shift that happens during a pandemic. Everyone and everyone's behavior becomes important. So it's a lot of work ahead of you. And I'm really grateful, Priya, that at least somebody highly qualified is leading the charge. And I hope that we can be, through Scale, we can be helpful to you in some way over the months and years to come. So I want to thank you for your time today and look forward to staying in touch.
Thank you very much. And maybe if I can leave you with one last message. So maybe two. So one being that what we're doing in terms of building capacity to help countries detect and contain pandemics should be seen as a core element of public health. It is absolutely central to building strong and resilient public health systems. And, we need to keep that focus. And in order to keep that focus, we need to sustain these investments and we need to scale them up. And to sustain and scale them, a key piece is country ownership and commitment, which we already have from our recipients. And, we want to build on that even further. And another piece is really effective partnerships with both our sovereign donors as well as philanthropies, foundations, and bringing the private sector in more fully into all of this. So I think, with the necessary commitment from and ownership from countries, and we're already country led, and the collaboration that we're seeing, building on that collaboration, the pandemic fund is well positioned, I believe, to deliver on its promise of creating a safer and healthier future for all.
Very well said. And also worth highlighting, operating costs of less than 0.5% of the funds, I read somewhere. So extremely mission oriented. I really applaud everything that you do, Priya, and really thank you for your time.
Thank you very much.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.